Hi, this is Michael Gilbert. I'm coming to you from Gilbert Physical Therapy to address a question this morning on whether or not someone needs an X-ray or an MRI. We're asked this quite often for different types of conditions, a lot of times for back problems, for neck problems. Maybe you have seen your primary care physician, they refer you to physical therapy without any sort of imaging, and you're confused on that. Well, one thing to address in terms of imaging is there's always the exposure to that radiographic image. So those waves being pushed through your body. So we try to limit the amount of exposure to that, obviously. But X-rays are easy to do. They're quick. They provide certain bits of information. So let's talk about what they provide. X-rays are going to show you images of the bony structure. So they're going to show you some spacing differences, they're going to show you fractures, they're going to show you maybe an unstable part of the bone where you may have a slippage, but they're not going to be really good indicators of soft tissue injury. MRIs, on the other hand, are going to show a little bit more in-depth picture. They're going to give you an idea of whether or not a disc has pushed out. They're going to give you an idea in terms of if there's some nerve impingement, and the way that they come, there are a variety of slices through there that will show a greater in-depth image. So when does somebody need one? Well, it's highly variable. There are some published studies that will show 65% of the population will be walking around with an abnormal MRI, meaning that they would have a herniated disc, lumbar stenosis, something going on the image anatomically that would make you think that they have more of a problem, but they might not have any symptoms at all. Likewise, we may have someone in the clinic who has a lot of symptoms and they have a pristine MRI, pristine X-ray. They don't have anything showing, or maybe just very mild degenerative changes, which sometimes do not always correlate with the actual problem. There is a stat out there that will show 95% of the population over the age of 50 is going to show some form of arthritis at some point and somewhere in their body on an X-ray. So that's a common finding, not necessarily always the indicator of someone's symptoms. So as a gauge, when we try to make a determination on whether or not someone needs those things, is generally we're going to look for, is there some sort of failure in treatment over the course of 4 weeks? That may mean that there's no improvement. That means that there's a progressive decline. One of the big things that we look for an MRI is we would look for progressive neurological decline. So in other words, if somebody would come in with a back problem from, let's say, a herniated disc, and they had pain referring down the leg, if initially that pain came in and it referred down the leg to a certain spot, but did not have any changes to the reflex or strength of the leg, and that progressed over the course of a few weeks, so in other words, somebody developed a lack of a reflex or started to lose strength or sensation in their leg, that would be warranted for getting an MRI done. If that patient continued to have good strength, if they continued to have good sensation, no problems with the reflex, and their pain just moved up and down the leg a little bit, that's not necessarily an indicator for an MRI. That might be someone who we can continue working with and make some progress on. So those are some of the guidelines that we will use in terms of making a recommendation for an X-ray or an MRI. Ultimately, this is something that you can consult with your primary care physician or orthopedist as well. They are the ones who are typically ordering those tests. Your pain management and other physicians can order those as well. So I hope this clears up a little bit in terms of whether or not you need an X-ray or an MRI taken. A lot of times the best advice to do is to ask your healthcare professional, not necessarily go based on the insurance recommendation on whether or not you need one or not, but get true guidance on what your particular situation is, and that'll help you be better informed on what you should do.